This week we're going to cover the bones and the landmarks of the shoulder and the upper back, and specifically the muscles of the upper back. So you have three bones that comprise the shoulder girdle. The clavicle, which is the only attachment to the axial skeleton. Two joints articulate with the sternum and the clavicle, and you have the sternoclavicular joint, which is your sternum and your clavicle, and the acromioclavicular joint, which is at the acromion and the clavicle. Your clavicle is the only attachment to the axial skeleton. Remember, the axial skeleton comprises the skull, the sternum, and the vertebral column. The appendicular skeleton comprises the extremities. The scapula, which has a vital role in our movement because it is the attachment site for 16 muscles. The angles and the attachments of all these 16 muscles allows the scapula to move very freely along the scapulothoracic joint, which is not a real joint, but it allows the scapula to move along the rib cage. The humerus is the last bone of the shoulder girdle, and it's the long bone of the arm. These are anterior and posterior views of the shoulder girdle. This is the anterior view, and I know that because here is the coracoid process, here's the acromion process, and the clavicle. So this right here would be the acromioclavicular joint, and on this end is the sternoclavicular joint. This is the first rib and the humerus. Right here you see the subscapularis fossa. So one of the muscles of the rotator joint, of the rotator cuff, the subscapularis, fits in this fossa. This on the right hand side is the posterior view, and I know that because this is the spine of the scapula. And here you can see very clearly how the head of the humerus fits into the glenoid fossa. And you can see that this joint is not a very deep joint, so it's not a very stable joint, but allows for a lot of mobility. This is a close-up view of shoulder joint. Again, you have the humerus and the glenohumeral joint here. This is the cartilage. This white on top of the humerus is the cartilage. This is the acromion and the AC joint, the acromioclavicular joint. Here is the coracoid process, clavicle, first rib, and right over here you see the spine of the scapula. So the joints of the shoulder girdle are the acromioclavicular joint, the sternoclavicular joint, and the scapulothoracic joint, which is not a true joint, and this is where the scapula moves up and down over the rib cage. And the last joint you have is the glenohumeral joint, which is the shoulder joint, where the head of the humerus fits into the glenoid fossa. Again, posterior and anterior views of the shoulder girdle, and medial to lateral view and lateral to medial view of the shoulder. So here is the medial to lateral, looking from the sternum to the lateral side, which would be where the humerus is. So you're looking here, here's your rib, this is your clavicle, this right here would be your medial or border of the scapula. This is lateral to medial, looking from the humerus towards the midline of the body. And here is your axial or lateral border of your scapula, clavicle, and again your rib. So let's go on and talk about some of the muscles of the upper back. And we're going to first talk about the trapezius, which is the most superficial muscle. And it's actually two muscles. We think about the trapezius as being one muscle, but it's two muscles with three sections. And the origin is on the occipital protuberance, the nuchal line, nuchal ligament and sinus process of C7 through T12, and the insertion is the lateral half of the clavicle, the acromion, and the spine of the scapula. These muscles act unilaterally on one side or the other, or bilaterally, two sides at the same time. So here's a picture of one of the trapezius muscles, and again we think about it as one muscle, but it really is two with three sections. These are the lower fibers. The middle fibers are more horizontal, and upper fibers are here. Now, what you notice about the upper fibers and the lower fibers are they are exactly opposite of one another, which means that the lower fibers extend upward, the upper fibers extend downward, which means that they can be an antagonist to themselves. So the trapezius is one of those muscles that can be its own antagonist. Here's another view of the upper fibers attaching on the occipital protuberance. And again, you can see how the upper fibers extend downward, lower fibers extend upward, and the middle fibers are more horizontal. Right here is the spine of the scapula. And these are the spinous process of the vertebral column. The next muscle we're going to look at is the latissimus dorsi, which is the broadest muscle of the back of the body, and it's one of the biggest muscles in the back. And the insertion point is on the anterior humerus, which allows it to do medial rotation. It can be palpated at the axilla, which is under the armpit. And its action is to extend, adduct, and medially rotate the shoulder at the glenohumeral joint. So here is a picture of the latissimus dorsi, and again you can see the fibers as the fibers come upward from the lower back, from the lumbar area, and it comes and inserts over here on the front of the humerus, and they actually flip over themselves, the fibers. So here's the trapezius, and the latissimus dorsi is just a little bit underneath, but again a more superficial muscle. This is the anterior view of the latissimus dorsi, where it fits onto the lesser tubercle of the humerus. This is the serratus anterior, which we talked about in class. And then this part right up here is the upper trapezius. The next muscle, which is a synergist to the latissimus dorsi, is the teres major. And synergist means that it's a helping muscle, and what you're going to see is it fits right underneath the and has the same line of pull as the latissimus dorsi, and it's palpated superior to the latissimus dorsi, and again its actions are to extend, adduct, and medially rotate the shoulder. Its antagonist muscle is the teres minor, and so here you see the teres major fitting right up here and inserts right onto the humerus, again following the same lines of pull as the latissimus dorsi. Here is the teres minor and the subscapularis. The next muscle we're going to look at is the pectoralis major, which is another one of these muscles that's divided into three sections. Again, you have two pecs, one on each side, divided into three sections. It's those superficial chest muscles. It's again, you're going to see upper and lower fibers are antagonists to themselves. These are the upper fibers, and the lower fibers here kind of extend upward, and the middle fibers are more horizontal, again, much like the trapezius. Upper fibers connect onto the humerus. The lower fibers actually insert underneath the upper fibers, underneath onto the humerus. The pectoralis major does adduction, medial rotation, and assistance in force inhalation. It means when you take a deep breath, you go, the pectoralis major helps to lift the rib cage. It also, the upper part does shoulder flexion, horizontal adduction, and the lower does shoulder extension. extension. Underneath the pectoralis major is the pectoralis minor. It's an endangerment site because the brachial plexus, the axillary artery, the axillary vein pass through this area. Endangerment site means you don't want to massage in this area to stop blood flow or to hit any nerves. And the last muscle here is the little subclavius muscle. It's a small secondary muscle underneath the clavicle. And so here you have a picture of the pectoralis minor with its origin on the coracoid process, and it inserts downward onto the ribs. Again, you can see that here. And this is the little subclavius muscle right here underneath the clavicle. The next muscle we're going to look at is the deltoid muscle. This is, again, a superficial muscle that covers the top of the shoulder. It is three muscles, the anterior, the middle, the posterior, and they can act as an antagonist to themselves. Origin is the lateral 1/3 of the clavicle, the acromion and spine of the scapula, and inserts on the deltoid tuberosity of the humerus. It does shoulder abduction when all of the muscles work together. It flexes the shoulder, medial rotation, and horizontal adduction for the anterior portion, shoulder extension, lateral rotation, and horizontal abduction in the posterior deltoid. And here again is the pictures of the deltoid. Here's the anterior deltoid, so this would be an anterior view. Here are the pectoralis major muscles, the middle portion, and the posterior portion of the deltoid. The biceps brachii is what we call the bicep muscle. It's a two-headed muscle on the arm. It's the superficial muscle on the anterior humerus. This flexes the elbow and supinates the forearm. It is a powerful supinator and helps to flex the shoulder. Its origins are on the coracoid process of the scapula and the supraglenoid tubercle. Insertion point, radial tuberosity, and biceps aponeurosis. Remember, an aponeurosis is a broad, flat tendon. And here's a picture of it as it spans over the humerus. Remember, the biceps brachii is also a two-joint muscle that crosses the shoulder and the elbow. The triceps is the only muscle on the posterior arm, and it extends the elbow, extends the shoulder, adducts the shoulder. Its origin is on the infraglenoid tubercle, the posterior humerus, proximal and posterior humerus distal, and its insertion is on the olecranon process. And here's a posterior view of the triceps and a closer view here of the triceps. Muscles can act unilaterally or bilaterally. That means they can act on one side or together. So for instance, your trapezius, when your upper trapezius works together, you have head and neck extension. When it works bilaterally, you have lateral flexion. The deltoid is responsible in all movements of the glenohumeral joint. The trapezius is activated when you hold the phone to the ear, and latissimus dorsi and teres major when you're unzipping the back of your dress.